Good morning, and welcome to your weekly Cup of Joe. My name is Joe King. I'm the owner of Physical Therapy Advantage in North Aurora, and we're going to be talking today about and actually the next few weeks, just going over some tips, post-surgical tips that myself and my staff have kind of collaborated on. Julie Crane and Christine Leshevitz put together a nice list of tips and pointers for you to have basically for your education and for your use, just in case you happen to be going into some surgery coming up. One of our biggest things is that we do not, advocate surgery by any means. If our client's goal is to avoid surgery, that's our goal as well. We don't want to have anybody going underneath the knife if they don't need to be. But if surgery isn't, the option or the one choice that you do make, which is totally fine, we just want our clients and the general public to be well informed and educated on what may be happening afterwards, especially because of pain, because of medication. Sometimes we just don't remember things quite so well. So we want to give you these tips. So below there will be either a link and or the list of tips for you. So you'll have both of those at your disposal to use, share it like you want to. So first week, or the first topic we're going to talk about, is total shoulder replacement. So that's either a regular total shoulder replacement or a reverse total shoulder replacement. And you could probably even use these guidelines for a rotator cuff repair or other shoulder injuries, but this is kind of more for the extensive complex surgeries of the shoulder replacements. First and foremost, definitely follow your doctor's protocol for movement and or lifting restrictions. Clarify those with them, and most typically you're going to find out that you're not going to be moving that shoulder actively for 6 weeks. So there'll be a sling. You want to make sure it's comfortable and fitted appropriately, but you won't be actively moving for about 6 weeks. Definitely take your medicines, the medications that they prescribed for you on a regular basis, and take them all and as prescribed. You want to stay up on the pain and stay ahead of it as much as you possibly can, so it doesn't get into that big bad pain cycle where now all of a sudden, I cannot take it, I'm feeling pretty good, and all of a sudden the pain gets so bad that you just can't do anything. You can't sleep, you can't eat, and your days, 1, 2, 3, or 4 days might be wasted. And with that, not only take your medication, that ice is going to be your friend during the time frame following surgery. So maybe just for 3 or 4 weeks, but maybe you're going to be using ice for 6, 10, 12, and maybe up to 20 some weeks afterwards, which is totally fine. It's a natural pain medicine, natural anti-inflammatory. It's never going to hurt you to use ice. So definitely use ice as well. If you have any questions about these, like I said, there'll be tips below. Take a look at those. If you have any questions on the tips we talked about today and look at that sheet, please don't hesitate to give us a call at 630-892-8003. That's 630-892-8003. Once again, my name is Joe King. Hope you have a great week, and we look forward to seeing you next week for your weekly Cup of Joe. Bye.